had, up until July of 2010, been appropriately discussing the matter in public forum with public input. However, at that point and to that point, they had had no negative input towards dispensaries being in the city. That's none. And recently, as a matter of fact, the media has been declined, has not been given anybody to say that they've been against it. So the city decided then to take the matter after being after the council was convinced that they should move forward, and then they told everyone they were going to move forward with an ordinance. They were convinced that they should by the citizens. They decided then to take the matter into closed session at the advice of the city, and then they were told, we don't know what, but has changed now to a ban, despite everybody in the city wanting it. You know, did you know that there were 14 locations, actual business locations? Now, IB is not that big, but there's 14 business locations that will allow for an individual to stop by and sign a petition saying that they would like to have, not rather a petition, but a letter to their council members saying that they want to have safe access. 14 locations.
What kind of locations are these now? Are these dispensaries you're talking about? Or?
Oh no, there's no dispensaries in Imperial Beach. They haven't allowed that. So what we have are just what's there. We have a couple of insurance offices. We have a pet cleaning. We have a couple of local grocery markets. We have apartment rental agencies. We have.
It sounds like the Imperial Beach community is united in opposition to this ban.
Including the Kiwanis Club. Yeah, absolutely.
What is driving this?
That's a very good question.
What's driving not the opposition, but what is driving the city to an outright ban rather than reasonable regulations? I mean, is it pressure from the county?
That's the point of the Brown Act. You had mentioned the Brown Act violation. The violation of the Brown Act. The Brown Act says that our city officials are to hold all meetings where they make decisions in a public forum. So they had made a decision on July of last year to in public forum to move forward with an ordinance. Now between July 7th and December, they moved to start looking at a ban instead. So the December meeting, the next time they brought it into public forum, somehow it appeared that they had had multiple meetings in between, and I looked through all the agenda items and all the minutes after them, and nothing was discussed about medical marijuana. However, their focus definitely changed. So that's what we call a violation of Brown Act, and so that's what we're referring to. But the citizens are for it. The council is against it, and they're illegally moving forward with a ban, and I have no idea why.
And you know, it's not just the citizens that support it. A 2006 study conducted by Amanda Raymond, PhD of the School of Social Welfare at the University of California, Berkeley, that's UC Berkeley, very respected research institution, examined the experience of 130 patients spread among 7 different dispensaries in the San Francisco Bay Area. Dr. Raymond's study cataloged the patient's demographic information, health status, consumer satisfaction, and uses of services, while also considering the dispensary's environment, staff, and services offered. And the study found that medical cannabis patients have created a system of dispensing medical cannabis that also includes services such as counseling, entertainment, support groups, all extremely important components of coping with chronic illness. She also found that levels of satisfaction with the care received at dispensaries ranked significantly higher than those reported for other healthcare facilities nationally. Patients who used the dispensaries studied uniformly reported being well satisfied with the services they received, giving an 80% satisfaction rating. Now, when was the last time that a hospital or a general doctor out there received an 80% satisfaction rating? And the most important factors for patients in choosing a medical cannabis dispensary were feeling comfortable and secure, familiarity with the dispensary, having rapport with the staff, and in their comments, patients tended to note the helpfulness and kindness of staff and the support found in the presence of other patients. So it's really important to understand that dispensaries are not just supported by overwhelmingly by residents and citizens in these communities, but also by research conducted at the University of California, Berkeley.
Well, you know, Berkeley, UCSD, all the major universities that now study medicinal cannabis or have ever looked at the effects of medicinal cannabis have all come back with the same results. And that is, in fact, marijuana is medicine. And that is, in fact, why we're on this show on nutradio.com. Marijuana is medicine with ASA's Marcus Boyd and Eugene Davidovich.
And another thing I want to focus on briefly is talking about dispensaries specifically. I think dispensaries get a bad rap out there in the community. There's a lot of hate mongering, fear mongering, talking about how they're crime magnets, especially the presentations that San Diego County's own Detective Michael Helms has been conducting throughout the county, including in Imperial Beach to the Kiwanis clubs and other municipalities around. But aside from, as I mentioned earlier, having scientific support for dispensaries, as proven by the research conducted by the University of California, Berkeley, dispensaries can also be good neighbors. Often, these places provide positive additions to their neighborhoods in which they locate. They bring additional customers to the neighboring businesses. They reduce crime in the immediate area. If you take a look at the crime statistics for the city of San Diego, for the county of San Diego, just over the last 2.5 years, specifically the time where we've seen a large number of dispensing collectives open both in the city and in the county. And if you take a look at the crime statistics directly around those areas, you'll find that it is absolutely significantly lower than compared to the crime statistics around banks, crime statistics around liquor stores, or any other type of business in the community. In fact, what you see in just about every single situation is a significant drop in crime in the neighborhood where a collective comes into. And San Diego's not alone. San Diego's not the first to see it. In LA,